So should I begin?
Yes.
Yes, okay. A very warm welcome to all attending today's panel discussion. Welcome to the fourth series of the third edition of the Scholarly Sunday session, which is organized by the Postgraduate Education Committee of the Psychiatric Society Western Zonal Branch. I'm Dr. Vinona Fernandez, working as a consultant psychiatrist at IPHP Goa, and will be moderating today's discussion. So before we begin, I'd like to invite our president of the Western Psychiatric Branch, Dr. Sudhir Bhave, to say a few words. Sir.
Yeah, thank you, Vinona. It's a pleasure to be here today. I think, like the previous programs of this subcommittee, Dr. Sushil has again conjured a very nice topic and very good speakers. I mean, we can always depend on the maverick Dr. Sushil for very innovative themes, I mean, which have been extremely well attended. I must say that the number of PGs attending every single meet is growing steadily, and that's a very good sign. So kudos to you, Sushil, for
Thank
thinking
you, sir.
of very useful topics. And I think it's a special pleasure. I mean, apart from, of course, Sonakshi, who is our Nagpur lady, we are proud to have her in Nagpur as a quite an erudite psychiatrist and associate professor of psychiatry. I mean, we have today three toppers of the three states which comprise of West Zone. So I think that was an extremely good idea by the subcommittee to have these three toppers. So I welcome Mohit from Maharashtra, Akriti from Gujarat, and Colin from Goa. I mean, these are the three state toppers, and I'm certain, I mean, with their academic credentials, they are going to be a big value addition to today's program, I mean, which is all about what to do in PG. I mean, their knowledge is very fresh. The textbooks they have read are the ones that, the editions that they have read are the ones that are going to be read by the current PGs. So I think that's going to make the whole thing very, very useful. So I welcome all of you three toppers and wish the program all success. Thank you.
Thank you, sir. I now invite our chairperson of the PG Education Subcommittee, Dr. Sushil Gavade, to say a few words. Sir.
Thank you so much, Vinona. Am I audible?
Yes,
Yeah,
sir.
yeah, you are.
Okay, yes. So, first of all, thank you, Bhave sir, for giving us this opportunity. And thanks to all my members of this committee for coming forward and taking initiative. The amount of hard work put in by Vinona and her team, I have witnessed this since last around 10 to 15 days, and it's phenomenal. So, without wasting any time, I wish panelists as well as moderator all the best. And I'm very sure that all the students who will be attending today's program, they will get largely benefited with the experience of Sonakshi and Colin, Akriti and the Mohit. So wishing you all the best, and I hand over to Venona. Thank you so much.
Thank you, sir. We now officially begin the discussion for today. Before we begin, I'd like to inform the participants that if you do have any questions or queries, you could type it in the chat box and then we will probably get back to them. Let me begin by just sharing my screen. Just give me a minute. One minute, I'm having an is this visible to all?
Yes, yes.
Yes, all right. Okay. So yes, I'd like to begin. I think Dr. Sudhir Bhave and Dr. Sushil has already introduced our panelists for today. But so we have Dr. Sonakshi, who of course is working as an associate professor at Nagpur. Dr. Mohit Agarwal, the Maharashtra gold medalist. Dr. Akriti, who is our Gujarat gold medalist. And of course, from my own college and my hospital, Dr. Colin, who has been the Goa gold medalist. I welcome you all. Are you all there with me? Yes,
Yes,
right?
yes, we're all here.
Yes. All right. It is
Hi.
great having four of you with us today. So the topic we chose today is, as PG students, there's always this question about, which book when I remember clearly when I entered psychiatry, the first thing I did was take all my books to the seniors, and I'm like, okay, now you've got to tell me which book and which topic do I need to read from which book, because we have so many books to read from, and then at the end, it is really so vast, and then it becomes really difficult to actually pick and start on, okay, what I'm going to do first. So coming first, I mean. At the end of today's discussion, I hope we are able to figure out, okay, what exactly we need to read. Of course, we are looking at all the gold medalists who are going to be talking to us. So I'd like to begin by asking, if you need a very strong foundation once you enter into a field. If your basics are good, you're going to be able to answer things and you are able to understand things better. So, Dr. Sonakshi, if you could let us know of any foundational books in psychiatry which could probably, be very essential for starting out in this field. Is there any book that you would suggest?
That's a very good question, Winona. And just at the outset, I'll tell you that it's been, of course, 10 years since I've done my residency. Editions have changed. So
Yes.
I was still rummaging through all my old books, and I still have few of them with me on the table right now. But yeah, like you very rightly, the question that what books you should read. Now, there can be different kinds of books. If you're going to talk about academic books, of course, there are those holy grail, and I will, of course, be mentioning them. Also, if you're talking in terms of, let's say, the first year PGs who do join in, I do also recommend that they read books on varied topics, not just books on academics. So there are a few books that really got me into it. For example, the non-academic one. So if you're going to highlight that part,
Okay.
books like, I don't know if anyone has read The Shrink by Lieberman. He was the principal investigator of KT. Gives you a good history of, psychiatry in a very layman term, just to give you a history of psychiatry. And of course, there
Yes.
are other books, and I think we can discuss that further. But in terms of foundational books that you must read when as a first year PG, and I think you need to keep reading and rereading them as I do right now as well, is of course CTP, the Comprehensive Textbook of Psychiatry, Captain and
Yes.
Sada. And there are, of course, different other books for clinical psychiatry. The books that I read and I found it very useful was Tasman's. The new Oxford Textbook of Psychiatry, I think you must have.
Yes.
Oxford Textbook of Psychiatry, there's also a handbook, so that's been very helpful to have and to read. But if you talk about psychiatric interviews and mental status examination, then Fish by
Fish.
Casey and Brandon, yeah. And The Sims, Symptoms in the
Yes.
Mind by Femi
Yes.
Obert. And for psychiatric interview, I found one book that was helpful, and I'm not very sure if a lot of students, I would recommend they should also have a read, is the Psychiatric Interview by Carlett.
By Khaled.
So, yeah. So I feel first year should be all about reading about history taking, mental status examination, and of course touching upon the clinical aspects, reading the books from, your CTP and your OTP. So that's definitely the basics that you should be, you know,
Yes.
reading from.
But yeah, that so thank you, Dr. Sonakshi. This was with regards to like the history and MSc. I mean, in the first years, as DPM students, usually there used to be a psychology and a psychiatry paper, but now, I mean, with MDs, it's all together. So the MD students usually tend to, leave out on the psychology aspect. So, Dr. Akriti, what is your comment with regards to the psychology books that one would need to read?
Yeah, so as you said, a lot of time we ignore psychology a lot, and
Yes.
the questions sometimes have been in the decreasing trend. But with the current scenario of clinical practice, we don't only need to be a psychiatrist, but also learning psychotherapy as well. So the major ones, I started reading Morgan. So the learning theory, memory, emotion, aggression, all these things are very well given in the end of the chapters. It's very well summarized also. There are good diagrams to make you understand what exactly they're trying to explain. Then other than that, even certain sites are there for particular therapy actually. So there's very well mind, there's psychology today. There are different, there's psychiatry times which keeps on updating about certain therapies and whatever changes are coming. This is a psychiatry times is a website which we refer for recent updates, and a lot of therapy related things are coming up there. So I think uh, other
Okay.
than that, tips also mentioned some parts of like therapy in like for PGs exactly for learning for examination purpose. So that's there. And in synopsis also some group therapy and all are very well explained. All the domains are explained so that we can be referred for the same.
Yes. Yeah, because I mean, psychology is something we tend to ignore as MD students. So yeah, yes.
Some
Uh,
people tend to read Baron. So I think I read Morgan, but
okay.
it's more colorful and pictorial. So I think.
Yes, yes. Uh, yeah. So moving on then, Dr. Mohit, how would you prioritize reading? Like Dr. Sonakshi said, you start with history taking and MSc in your first year and things like that. So the topics are enormous. There are large number of topics, and there are so much to read. So how would you really prioritize? After that, what do you do? Like, what would be the essential topics or books to start with, then you need to add on to the information, but what would be the essential, like if you need to start, where would you start?
Dr. Vinona, thank you very much for the question, ma'am. I would prefer going it via year wise. The preparation has to be year wise. Your first year should be focusing upon the fundamentals, the diagnostic skills, and the clinical approach. For that, as we have discussed, Kaplan's and Sadok's synopsis of psychiatry is a very good quick reference for all the context-based studies that students must be doing. Apart from that, fit clinical psychopathology and symptom and minds are a must read. Psychology, yes. The key disorders to master in the first year would be schizophrenia, mood disorders, anxiety disorders, substance use, as well as the personality disorders. Apart from that, diagnostic criteria as per ICD-11 and DSM-5 that should be done first. And also mental health care is to be known to the students, because there will be a lot of cases that they will be seen for risk assessment and suicidal ideas and all those things that should be known to him. When they move into the second year, they should be more concerned about the advanced concepts like psychopharmacology, psychotherapy, consultative psychiatry, subspecialty topics like child psychiatry and children's psychiatry. When they come into the final year, it should be more about research based articles, preparing for their final year examination as per the questions which were asked in the last time. So this is how they can go structurally year wise if they want to prepare.
Okay. Dr. Colin, would you have any opinion with regards to this?
Yeah, so I agree with Mohit, but in addition, what I'd like to add is that it's always more so in the initially in the first year and maybe start of the second year. It's very nice to also read for the joy of this. You get a patient, you're seeing an obsessive compulsive disorder for the first time. You're very interested by the phenomenology. To go back, read a bit more about that, read a little bit about ERP at that time, maybe like make it more patient specific. I think all of us will be working with a lot of alcohol uh, dependent syndromes and learning things like motivational interviewing by reading Miller and Rollnick's book, which I guess most or all our libraries will have. It's available free on LibGen, and all that are very nice books to read to add to our learning. So that helps us understand the field a little bit better and also helps us get in the diversity of approaches that can be there.
Okay,
So
yeah.
definitely reading for the joy of it and being more patient specific helps.
Yeah, probably
Yeah.
when you're seeing a patient and then it evokes that interest. Okay, what can I do further? A little bit of
Mhm.
that
Yeah.
enthusiasm.
Yeah.
Yes.
Mm.
Dr. Mohit, you mentioned something about the classification systems in psychiatry. So what would you say? I mean, like which one? The DSM, the ICD, which one, or both?
The classification forms the very base of our diagnostic clinical skills.
Yeah.
So reading about them in detail from ICD.
Dr. Mohit, sorry to interrupt, but I think your the network is a little. I mean, I can hear
Hmm.
you on and
It's
off. Yeah.
breaking.
Yes.
The voice is breaking, Mohit.
Yes.
Okay, sir. Now is it okay, sir? I am a little near to the Wi-Fi system.
Yes, it's better.
Okay, so starting with the classification has to start with your ICD-10 and ICD-11. Basic classification starts from there. We should know about how diagnosis was done in ICD-10 and what are the changes which are being incorporated in ICD-11 and what is the basis for that. Apart from that, DSM-5 TR is an excellent book when you are unable to understand ICD-11 that well. So all these three classificatory systems should be taken into consideration while seeing a patient. The other thing that might help us is to write down the diagnosis as per these three classificatory systems for the same patient while we are seeing the patient in our IPDs. So that reading more about them can be done with the help of shorter Oxford textbook of psychiatry, which has given a very nice classification systems overview. Apart from that, CTP's latest edition also has a chapter on psychiatric classification, which can be undergone. So these are the things that I will prefer that can be read in the classification of psychiatry. Apart from that, you can read on articles on research domain criteria, which are very helpful for other people.
Yes. So yes, so that was about the classification. So I mean, let me know, what Harrison says to medicine. Dr. Sonakshi, would you say is there any which is the book in psychiatry, or which would you say is psychiatry's Bible to go to and have to know all about it?
So, like I said at the outset, I think I'll be repeating it again. Yes, CTP is always going to be the holy grail and the Bible for us.
So
Yes, so
would
of
you say
course.
synopsis versus
But
CTP?
synopsis, yeah. Having said that, of course, synopsis and is also helpful. But yes, I mean, you need to go back to your CTPs, and I still do that. I still go back to my CTP for. I mean, that's something that you cannot miss. I know it's something that you cannot really complete. Like I said, I'm still rereading it again and reading it also, some parts of it. But CTP is a must. And of course, I said OTP, another Oxford textbook of psychiatry, is also very helpful. I found some parts in Tasman's also very helpful, but yes, you cannot ignore. And Fish and Sims. I still have my third edition with me. I think it's the seventh right now.
Yes.
Yeah. So,
Yeah.
but I still go back to the third edition oftentimes. So, yeah. So, Fish for your clinical psychopathology, Sims, symptoms in the mind, again for psychopathology, and yeah, CTP.
CTP, yes.
Yeah.
I think we need to. I mean, because a lot of people say, no, why do we need to read the CTP when the synopsis gives us what we need to know? And I'm like, no, there's always so much more to read in the CTP. So yeah.
It's always better. So like I think, like Dr. Colin had mentioned that you go case wise because it's better for you to understand if you're in the clinics, not just case wise. I think rounds, oftentimes in clinical rounds, your professors do mention certain topics. I think it's good for you to go back and maybe have a read through synopsis and then to go delve a little bit deeper. Then you go back to your CTP, but you cannot not do without CTP.
CTP, yes, yes. Completely agree with you. Okay, so moving ahead, if we need to go a little bit with regards to, topic wise, like I've just picked up on some of the major ones and we will discuss the other ones a little later. So, moving first, to schizophrenia. Dr. Colin, what's your say on, which books for
Yeah,
schizophrenia or psychotic related
yeah.
illnesses?
So as Sonakshi ma'am rightly pointed out, CTP is our Bibles, and CTP it's given very nicely. We know that the psychopharmacology part is by John Kane, who's pretty much the gold standard person when it comes to treatment in schizophrenia. As ma'am pointed out, Oxford and Tasman are both good books. Lieberman, one of the authors of Tasman, is also has his own books on psychosis. So definitely, it makes sense to stick to the gold standards for that. If you're a new first year, there's this very nice topic on recovery in schizophrenia, which when I read it in my first year, maybe 1 or 2 months in, I realized like, okay, it adds a little bit more to our understanding and what we should be looking at it in our outcome, because there's more about resilience than basing on a little bit of what we can counsel our patients, and also that's very interesting. But yeah, definitely for skiz it makes sense to stick to the gold standards, because that is kind of a really key topic in psychiatry, and the gold standards books do a really good job with them.
Dr. Akriti, what would you say about the depressive disorders? The more common mental disorders, and of course, including bipolar. What would you suggest there? Anything in specific?
I think Dr. Colin has already told about CTP. I would personally say CTP seemed a bit too extensive for me at times. So what I would do is I would go to synopsis. I would read that. The portions where I found that I was not able to connect two dots, that is where I reached back to CTP and I read those. I have read major disorders. I'm still now in my SIship. I'm trying to cover a lot of things from there. But yes, and you can, it's very well given in synopsis, all the types of depression and even seasonal, even postpartum. It's given in the back part, postpartum blues and depression in the reproductive psychiatry. And other than that, in the front pages, you can read about depression. Other than that, for and there are certain PG notes also. Even it's like go to in last moment for exam goings. Cjo Alex, you can read, and you can cover. I think certain basics MSc, how to go about understanding the clinical part and understanding what the patient is going through. That you can read from Sims, assessing the mood and that part. And I think there are CPG guidelines that are very well given for Indian patient scenario. So we can go through that for mood disorders. They're specific for mood, they're specific for bipolar disorder. And when in postpartum, peripartum, in fact, one of my faculty himself, Dr. Balaji Bharadwaj in JIPMER, he has written about CPG guidelines on peripartum psychiatry also. That's a very good set of things to go through, how to go about seeing the patient and writing the answer, flow of answer.
Okay. Uh, Dr. Mohit, the more common, the substance use, at least for us in Goa, it is quite a bit. So substance use, which is something which needs to be read from various, sources. What would you say about that, with regards to substance use?
Ma'am, as for everybody, the base should be comprehensive textbook of psychiatry and the chapter on substance. For a bit of legal reading and to understand the concepts of substance use better, I would prefer, I have read Assam Principles of Addiction Medicine, which is quite expensive, and you can always decide upon to the chapters that you can read from it. So I will say the core concepts of the addiction medicine, the assessment, diagnosis, substance specific
Dr.
disorder.
Mohit, I'm sorry, again, there's a bit of your voice is breaking.
I'm very sorry, ma'am. Is it a little better now?
A little better.
Yeah. Okay. Now, can I go ahead, please?
Yes, yes.
Okay. So the core concepts of addiction medicine, diagnosis, substance-specific disorders, treatment approaches, all those things I have read from the Assam Principles of Addiction. And it is quite an extensive book, but it is a very easy. So I will prefer everybody to go through it one or two chapters of their liking to start away with after the comprehensive textbook of psychiatry is read. Regarding the guidelines and the articles, we have Indian guidelines on substance use disorder by ND Ames, which is quite extensive. It is approximately, I guess, 85-90 pages guidelines. They have given everything. And apart from that, whatever you could not understand, you can read literally from with the help of a lot of review articles and substance specific guidelines which are available there on the in the form of articles in either JAMA Psychiatry or Word Psychiatry. That can be done. So this is how I had gone about substance use disorder.
Okay, and what about OCD? I mean, OCD is also something which you need to take out from various books. I remember when I was reading OCD, I mean, I think I got a lot of it from the anxiety textbook and things like that. Specifically the phenomenology and all those things. What would you have to say about OCD? And any specific books besides, of course, CTP and you know?
CTP was the base, ma'am.
Yes.
The epidemiology, pathophysiology, classification, diagnosis, which I read from. I
Dr.
had
Mohit, is there a way that you could move to a place with, like, I mean, you are breaking up, so we are not able to.
this is better, ma'am.
Yes, yes.
Yes. Okay. So apart from that, the various mechanism for treatment I had read from Stoll's Essential Psychopharmacology. Regarding the treatment part, I had particularly studied NICE treatment guidelines for OCD because apart from giving the guidelines, they also tell us a lot about how guidelines are formulated, how guidelines are to be read, and how guidelines are to be followed. It is quite extensive as given in NICE, but it is a very nice read. APA guidelines are also available freely online and that can be read. And the IPS guidelines as given are very comprehensive and concise and can be gone through. Am I audible, ma'am?
Hello.
Hello.
If I may add,
Yes, ma'am. Please go ahead.
so for anxiety disorders, what really I found really helpful during my residency, and I think it's one of a very good book for I think all PGs should definitely read it, is this textbook of anxiety disorder by Steen and Hollander, and I think it's come up with the latest, and the anxiety, trauma, and OCD related disorders. So I think it's a must read if you want to, understand the phenomenology of anxiety disorder. It's a very beautiful book. So it's a must, it's a recommendation. Definitely it should be amongst, the must haves in psychiatry, a book that you must read, especially if you want to learn more about anxiety disorders. So I feel that's a helpful book. And along with guidelines, I think for mood and anxiety disorders, you also have the CANMAT guidelines. I think that's also important for all PGs too. Besides the APA guidelines and your Maudsley, I think CANMAT guidelines for mood and anxiety also is important to read before you go for your examinations.
Dr. Vinona, you're not audible.
I guess Dr. Vinona might is logged out.
Yeah, it's turned off.
So let's wait for her to join back.
In the meantime, I think I'll add just that for OCD, what we had one booklet by N.N. Raju. He has explained from the diagnosis to psychopathology to treatment to CBT to OCD in children to even neurosurgery and the neuromodulation techniques that can be used for OCD. So I'm not sure if we used to have a small booklet, but it was golden.
Okay, I'm sorry. I think I lost you all for a bit. Yes. Okay, so moving on from OCD, Dr. Sonakshi, would you? I mean, with regards to regional aspects, these are all textbooks from all over, like in the US and all other places. With regards to considering Indian aspect or the societal, the cultural aspect, is there any textbook that you would advise to go through? And if you do, like any specific chapters from those book?
So in the Indian context, of course, I think now the IPS also has taken up some textbooks for the post undergraduate education. I think that does have covered that part, So I mean, all the books that we read, of course, are American. But there are some IPS books. For example, there is this IPS textbook for undergraduate psychiatry. I think we can have that, in our library and can look into it. You can go to the IPS website and you will find all these books available there. And there are, of course, the subspecialty books as well. Like, for example, the IPS textbook for sexuality and sexual medicine is one. Again, they have a lot of, there's a lot of regional context to psychiatry in those books. So,
Okay, and what would your say be on the Neeraj Ahuja? I mean, that's the other book that.
for me, I feel, books, I know it's, we give recommendation that this book and that book, but I feel what works for you. And I think having a read, whether it be Ahuja and your CTP, if it's helpful for you, definitely helpful, definitely. So Ahuja is from the Indian aspect, from the Indian context, I think it's a good book.
Okay, yeah. Okay, moving on to psychopharmacology. Is Dr. Colin, is
Yeah.
there any must reads to understand pharmacology? I know, of course, Stults is there. I
Yeah.
mean, besides Stults, is there anything else that we need to read and look at, to understand the psychopharmacology part better?
Yeah, so psychopharmacology is probably one of the most interesting things, and it's also something that no matter how tired you are, you can read. So for a hectic duty, one of the books that I always loved was Maudsley, Prescribing Guidelines. That was one of the first books I read along with Fish that time, and it gives you everything you need to know. You get the doses, you know what's your starting dose, you know the equivalence with other doses, you have an idea of the guidelines, you have an idea of the side effects to look out for. Things like clozapine also are given very nicely, including the monitoring. So it gives you everything you need as a first year, second year PG student. Star's Essential Psychopharmacology is a brilliant book. It helps you understand the molecules at a more receptor specific level. It helps you make sense of what you're doing and why you're prescribing something, why you're adding on something or augmenting one drug with the other drug. And the prescriber's guide is something that it's not something I would recommend reading it like continuously, but when you're using a drug, it's nice to go and open that drug and read about only that drug. Otherwise, the prescriber's guide tends to become a bit repetitive, but it's a very useful book when it's now say you're going to be using a drug for the first time, like the first time you're trying to use bupropion or desvenlafaxine. It's always nice to go through it so that it gives you that little bit more confidence while you're prescribing it. Most of the times in our residency, it's as SRO, our consultant, who has told us, okay, try this drug, and you might not be too familiar with it. So the prescriber's guide is a very quick resource that you can keep on your phone and look through that time in that 1 minute while you're walking back to your OPD before you talk to your patient about the drug. So that's definitely something I would like to keep. I didn't read during my the American Psychiatric Association's textbook of psychopharmacology was not something I knew about during my residency, but recently I've come across it and I found it to be also a very nice book that also covers the combination nicely. But definitely, over the course of the PG, you'll have enough exposure to psychopharmacology. The three main books remain Stahl's, Maudsley's, both the Stahl's and the Maudsley, but definitely you get these add-on books which are also very rewarding and might add certain topics in more detail. So can definitely be explored.
So moving on from psychopharmacology to, the other aspect of it, the therapies. Dr. Akriti, your take on psychotherapies and books or guidelines or articles that one needs to read or look through to understand the therapies better.
Yeah. So for my PG exam, I had made notes from different this very good sites that I previously mentioned for psychotherapies. There's in fact Marsha Linehan has provided for DBT. Similarly, Judith Beck has provided for there are in fact full books that you can refer to, but definitely not for exam purpose. But you can refer it for good reads as well. And Better Help is there, Psych Central is there. They are explaining psychotherapy in like brief. What are the components of it? What are the uh, 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 parts in which you will proceed? What will you do with the patient? What will you do with the caregiver? So these are the websites that I have mentioned here already, and there's then certain good reads for if you want to go for detailed reading further and you want to read a specific therapy. Then there is REBT by Albert Ellis, DBT by Linehan, and definitely this is a very good book. I think a lot of people have read this. CBT by Judith Beck. There are even courses you can do by Becker's Institute for the same. And recently, I'm doing my child fellowship. So I'm reading this Between Parent and Child by Ham Janot. So these are all therapy related books. But if you want to go the short way for exam purpose, I think Synopsis has mentioned a lot of from the older psychoanalysis, psychodynamic therapy to group therapy to the newer ones, mentalization based therapy. So it has mindfulness based therapy, everything it has mentioned, and you can add it on with even tips. I think volume one has that section of psychotherapy only. So this is mainly PG exam oriented. So you can add on from these websites, and it's a little deficient somewhere, so you can just add on.
Dr. Mohan, would you like to add on to anything else with regards to therapies?
Ma'am, apart from reading CTP, I would prefer Gabbard's Treatment of Psychiatric Disorder.
Okay.
Excellent book when it comes to case-based discussion regarding psychotherapy. The recommended chapters will be psychodynamic therapy, CBT, and supportive psychotherapy. Apart from that, on a day-to-day basis for your clinical practice, interpersonal therapy and supportive psychotherapy can be read from IPS. So this is what I have to add on, ma'am.
Okay. So then moving on, we also know that, psychiatry is not just psychiatry. We always have this intersection with neurology, neurosurgery. So, a lot of neuropsychiatry. So, Dr. Colin, do you want to let us know about books that we could read with regards to, neuropsychiatry? Dr. Colin, hello? Hello?
Yeah, sorry, can you hear me?
Yes.
Yes. Yeah. So everyone would have heard of Leishman's Organic Psychiatry. That's one of the recommended books. A really lovely book to read. In addition, CTP gives neurology very nicely. Alright, so that's what I found useful in the month before my exams. I would look through CTP rather than Leishman's. But Leishman's is a lovely book to read. For the neurology part, one of the books one of my consultant in neurology had recommended to me was Adam and Victor, and that I've read the part on localizing the lesions, and that is something that is given very nicely in that book. So if you all have access to that, definitely something worth reading. Kaufman's is also a nice book to go through. APA also has its textbook. The American Psychiatric Association has its textbook on neuropsychiatry, and of course for catatonia especially, Max Fink is the gold standard, so that's something worth reading. In addition, we know that we also need to know a bit of neuroanatomy, neurophysiology. All right, Snell's tends to be a good book for that. Most of us during our MBBS might have read Inder Singh, and that also kind of works. Also, we know that something like I had also used the tips, the notes for the neuroanatomy and neurophysiology, which were helpful. And also, there are some lovely YouTube videos. So you can, of course, look through that. Like what I had found was something called Ninja Nerd. And in that thing, like the direct and indirect pathway of the basal ganglia and all that were things that, which when I was reading, weren't exactly making sense. But when it was drawn in a diagrammatic format, it came to life. It made sense. It helped me understand better. So definitely, if you're finding, because I think many of us might find neurology a little bit difficult at times or difficult to understand the pathways, and sometimes seeing the diagrammatic representation is helpful. Okay, and of course for clinically, because staff is your go-to, which you would want to read uh, end to end in order to do your clinical examination well and understand what you're doing.
Okay, Dr. Sonakshi, anything that you would like to add on to with regards to neuropsychiatry?
I think Colin has covered it really well. So Lishman is definitely, again, if you have to say one book you need to read is Lishman. Bigger Stuff, definitely. And I think Stubborn Black for your higher mental function should be, I think these three books should be there in your library, if not the others. But you should definitely have them and start with them. So, yeah.
Okay. So moving on, with the other topics, okay, yes, I mean, another big topic which we usually need to focus on is, to do with child. Dr. Akriti, you're doing your fellowship in this. Your take on what needs to be read with regards to child and adolescent psychiatry.
Yeah. So for child, the go-to book is Rutters, definitely. It explains you why it is happening and what has been the research in this field since there are limited research in child generally because of the ethical issues, but whatever the meta-analysis and the case reports, it mentions about that all. There's another book, Lewis, child psychiatry book, and it also explains in a different, that this is just a different format, but it's a good read and definitely have CTP, and it covers most of the this child development, Erickson and Piaget, and the cognitive models, how they grow. That has been explained. There's for child we have a different classification system for diagnosis. So there's the Rutter's multi-axial diagnosis. So we generally follow that. The axis 1, 2, 3, 4, 5 is different in that. So when you're reading child, you diagnose it with one with the psychiatric diagnosis, two with learning disability, three with if the child has intellectual disability, four you cover the medical, and fifth you cover the psychosocial part. That's very important in child. For infants, we have the classification of developmental disorders for infants and early childhood, that is DC-05 TM. So these are different classifications that we're following in child. Other than that, there's a book by McBoy for psychopharmacology in child. That's a very extensive book. I've just started reading. I could not read in PG, definitely. For
Okay.
PG level, I think it's fine to stick with Rutters and either CTP and synopsis. So that should work. And there are definitely for pharmacology, Maudsley very well describes the treatment because it is very important that we do not go high dose in child. So exact dosing, how mg per kg you have to start like that, like we do in pediatrics. So for autism, for ADHD, there are very good tables in Maudsley, and Stahl's explains why ADHD happens, how it happens. It's very well explained in Stahl, so we can refer to that for the same. Yeah.
Then there are those other topics, which we are like, okay, should we read them from synopsis? Are they really that important? How much do we read and from where? Dr. Mohit, your take on feeding and eating disorder.
So regarding feeding and eating disorders, specifically to exams, I guess synopsis is enough for everybody to read and write answers. If you're really interested in knowing a bit more about it, you can go through comprehensive textbook of psychiatry. What I had read Oxford Handbook of Eating Disorders. Oxford Handbook of Eating Disorders has given in detail as to how the diagnosis has evolved over the course of time and what is the validity of the diagnosis. Apart from that, various psychotherapies related to the eating disorders have also been. But all said and done, CTP is good enough, and synopsis more than that. If you do not want to go through CTP, also is good enough for the exams. Regarding the treatment guidelines, nice guidelines could be sought after. There is a recent review article which has come about the international comparisons for feeding disorders. So that can also be gone through just to have a comparative thing regarding different kinds of guidelines which are applicable in different countries.
Okay. Dr. Collins, sleep.
Yeah, so the gold standard for sleep is, of course, Principles and Practice of Sleep Medicine by Krieger, Roth, and Dement. But very often we might not really have the time to read that, and most of we'll be reading in the second year. So what I found really useful was the Oxford Handbook of Sleep Medicine, given very beautifully. Even thing like REM behavior disorders and all, which you don't get so well in other thing, is given nicely, easy to read and quite quick to read, which is useful. The International Classification of Sleep Disorders also has their booklet with their whole classification and this, which also helps. And of course, IPS has very nice guidelines on sleep disorders, which are also a very useful addition to the reading.
Okay. Dr. Akriti, psychosexual disorders and things like that, the dissociative disorders, the psychosexual disorders, gender related.
Yeah. So, for dissociative disorders, I mainly refer to CTP, and there's a very good book by Elizabeth Howell. So, she kind of mentions she starts with what is a etiology and what are the reasons behind it, how it comes, what are the different emotional trauma and everything, and then she goes along talking about psychopathology and how it can be addressed to therapy and everything. So that is a very good read. For sexual medicine, I referred synopsis, and then for therapy specifically, sensate focus therapy. We have a very dual sensate focus therapy given by Masters and Johnson set is very wonderful thing to practice for the medicine part. It's very important since most of the patients will be coming for that, and you have to address that very particularly in confidence. So that for that, obviously, we can go back and read Stiles and Maudsley. So that covers it. It's very well, the dosage and everything is given in prescriber's guideline very well. So quick referral, we can go through that.
Okay. I think we may have to skip this a little bit, but moving ahead to something a little more important, forensic and ethical challenges and things that we would need to read. Dr. Mohit, anything on this?
Ma'am, there are 4 basic books which are available for forensic psychiatry. One is Pari's textbook, one is Banerjee's textbook, one is Satyanarayan Rao's textbook, and one is Jiroha's textbook. So while Rao's textbook and Banerjee's textbook are more of reference book and less structured, I found Jiloha very easy to read for the exam. It is very specific, it is concise and exam oriented. And there are stepwise forensic evaluations which are also given in Jiloha. So I would prefer Jiloha to be read by every psychiatric. There are a few articles for the MD psychiatry students. First one is Forensic Psychiatry in India, Issues and Challenges by Satyanarayan Rao et al. The second article is Expert Testimony by Psychiatrists in Indian Court, which is given in Indian Journal of Medical. The third one is Criminal Responsibility and Mental Illness in India from Journal of Indian Law Institute. The fourth and last one is Role of Psychiatrist in Determining Testamentary Capacity in India from the Medical Legal Journal of India. So these 4 articles can be read apart from Jiloha, and I think that will suffice for your understanding.
Okay. Okay, so moving on from chapters and things like that. Dr. Sonakshi, any specific guidelines that students need to know about, whilst answering their MD,
Okay.
any specific ones?
So of course there are many guidelines, but I feel that all students must, and it's a must that you should know. So starting with from our country itself, the IPS CPG guidelines are beautiful. I mean, everyone should go them. It's on the website. It's on the IPS website. So ASCPG guidelines. Besides that, you have your APA guidelines, the American Psychiatric Association guidelines. All of these are all available online. So you need to you should know that. There's this Maudsley's prescribing guidelines in psychiatry. Then there's NICE guidelines, and it's specific to mood and anxiety, the CANMET is, I think, a must that all of us should, read about.
Okay. Okay. So moving on from, I have done this like chapter wise and, specifically textbooks wise. Of late, I have heard, I probably, it wasn't there like when during my time, there have been a lot of question banks and MCQ books which have come out in the recent, So what is your take on these? A lot of students I have heard, just read this and they're like, this is enough for us to answer the exam. Dr. Akriti, would you like to comment on this? With regards to
Yes.
exam, yes.
Yeah. So MCQ, for like I did not read mainly in my PG, but for my entrance, and I appeared for JIPMER entrance. In that, I went through OSC by Albert Michael. It's basically MRC psych book, but it's the psychopathology and that kind of questions are very well given in that. And you have section wise different child and everything you have. I mainly went through child section. Other than that, we have Stahl's self-assessment book that has come out. There's for Indian authors, definitely we have all read Praveen Tripathi's book. So he also has MCQ book. There's a MCQ book by Prashant Agrawal and Neurointegrated Questions by Pramod Gayatri. So these are certain books that have predominantly MCQs, but certainly you cannot rely on that. You can for your knowledge maybe because since we have theory a lot, but it can help with mainly Viva questions sometimes, so that's helpful. Or if you're planning to give any entrance exam afterwards your PG. So, yeah.
Dr. Mohit, Dr. Colin, Dr. Sonakshi, your take on this? Any specific, there are new books I heard which are very Viva specific and things like that. Would you all, your comment on it? Would you all have any idea about it?
There is one volume of tips which has come specifically for the table Vivas.
Okay.
They have covered most part of what is to be known during your Viva examination.
Okay.
But mostly it is making your own notes regarding the Viva preparation throughout the course of the 3 years, which come in handy while you are giving.
Okay. Okay.
What worked for me during my examination, if I go back and if I have to tell the students, is like what I still have them. The notes that you make during rounds, they are your professors and your teachers, and they are also your examiners. So the questions that they do ask you during rounds do come back to you in your final year. So keeping those little notes, and not just notes in your notebook, but going back and reading and probably making notes has been really helpful for me during my Viva. And I guess during our time we didn't have we didn't have these books that these MCQs and Viva books. But yeah, we had those notes that were handed down by our seniors, and there were these compilation of notes by our seniors and by the various, we had the PGI notes and the NIMHANS notes that were circulated, and they were very helpful. So I think that is something that that will help, if you can't read CTP on the last day. But yeah, I don't know, maybe it works for the students nowadays to flip, but I would recommend please don't read it in your first year, and maybe a day or a week before your exam, just to brush up whatever you have read, maybe, but not a recommendation unless you're giving your post your MD, if you're planning to give your DM exams or postdoctoral. I'm sure it might be very helpful there.
Yeah, I think that's very good advice that you've given across, Dr. Sonakshi, because a lot of them tend to say like, okay, we're just going to read this last, like whatever, and then leave a lot of things, the main books behind. Dr. Sonakshi, what do you think is the role of, because we were having this whole discussion, you said, there are a lot of other books which would probably help in better understanding of psychiatry as a subject, need not be, educative or, with regards to just for your better understanding, fiction or non-fiction books that you would like to,
Yeah, so This is, of course, for a lot of readers and people who love to read. I think that's a good way. But I feel psychiatry is not only in these books, it's also in the movies you watch, it's also in the other books that are there. And there are a lot of books out there, and I would probably just talk upon the books that really was helpful for me. And I think it's my recommendation. But I think everyone, as a first year, when you I mean, just before you start your fish, I feel, the first 2 weeks when you're still, during your orientation, when you've just joined the department, I think you can start off reading those books then, especially. So, Viktor Frankl's book on the man's search for meaning, it's a beautiful book. I think everyone must read it. Shrinks, like I said, I have the Shrinks with me also. I mean, yeah. So Shrinks is one book that I felt that gives you a beautiful history about psychiatry. Of course, it's American psychiatry, but it gives you a beautiful history of psychiatry in general. So it's by Jeffrey Lieberman. Other books, I would say Oliver Sacks is another book. Oliver Sacks is a neurologist, so he's written a lot of many books. But I think the book on hallucination and the man who mistook his wife for a hat gives you a very beautiful, a description of a lot of perceptual abnormalities, and I think that was also another nice book to read. But if you want to talk about mental illnesses and people's lived experiences, I think this book called An Unquiet Mind by I've forgotten her name, Jameson, yeah, Redfield, yeah. So she a psychiatrist herself, and who talked about her experiences with bipolar. It was a very beautiful rendition. So I think that's a book that, to understand lived experiences of your patients, I think sometimes it might, you might read the pathology, the epidemiology, these are the symptom, ICD, and all of that. But I think the lived experiences of your patients is something that's you cannot learn from these books alone, from your CTP alone. But from the caregiver's aspect or perspective, this book by Jerry Pinto, I mean, of course, he terms it as a fiction book, but it is, he's taken this. He's also had an experience of taking care, I think, of his mother with bipolar. So it talks about the, his experience as a caregiver with a mother with schizophrenia. So I think reading these books are also very important, especially during your first year. Helps you see things very holistically. I mean, psychiatry is not just in the books, and it's not just in the, uh, in the clinics or the classroom. It's also outside. It's in your experiences with your in your experiences with your nursing staff, the senior nursing staff you've just joined, and they've had a lot of experience with patients. They can teach you a lot. With the ward attendants, who have had, taken care of the patients way before you have joined in, you may think, oh, I know the CTP, I know all of it, but a lot of things can be learned there. From your seniors, from their experiences, from your co-PGs, while you're still learning together, this is what I learned, this is what I did. I think a lot of psychiatry is learned outside of the books. It's everywhere. I mean, so in all your interactions. So, but yeah, these books have been really helpful for me. And if it's helpful, I mean, you can have a read. But one book I would suggest is Man's Search for Meaning. And these are all little small books. I mean, they're not really, not really bulky. So it's something that you can start off with.
Yeah,
Just my recommendations, yeah.
I think you've told it so nicely. You have to see psychiatry holistically. We tend to look at it, bit by bit, and it's not only that; it's everything. I mean, because we are running short of time, I would have loved to speak about the movies and the web series, but before we end, I would want to know, like from each of you, from Dr. Mohit, from Dr. Akriti, and Dr. Colin, you all are gold medalists in your respective states. What it has a gold medalist, what would be that one piece of advice you would want to share with the PGs today? Maybe,
Um,
yeah, Dr. Mohit, maybe first.
to start with, ma'am, people should practice writing their answers before the exams. At least 2-3 months before the exams, they should know how to organize their answers in a very structured. So whenever you see a LAQ, you need to know what heading you are going to cover it under. And accordingly, the heading should be covered. The diagrammatic representation should be there. The presentation is what that matters a lot to the examiner. So I will say presentation matters, and people should write their answers beforehand as a matter of practice for the university.
Okay. Dr. Akriti.
Yeah, so I'd just like to add one more book that was very interesting for me by Dr. Daniel Goleman, Emotional Intelligence. It is actually helpful for us as well as to help out our patients. So for me, what worked was sticking to what I had prepared in my previous years. I collected, I stick up notes and pages in my synopsis, and I wrote down everything from CTP, from Maudsley, from everything one at one place. Even rating scales, what are the cutoff, because everything is not given at one place. And running back to so many different books, it's easy to get confused in the last moment. So last 6 months, you should focus on collecting all the data at one place, all the guidelines and everything. So one topic, you have one folder, that's it. So that worked for me. It was quick, it was easy to revise, and it's important. Revision is the most important part. That is what I feel, rather than reading elaborately from CTP if it's not possible for you. So the trick is to like make notes from that in your first and second year, and you just go through synopsis. If you're able to memorize more in synopsis, then you'll be more productive than even if you have read CTP once but not able to reproduce that. So that's important. So keep your own notes and revise, revise, and revise many times. That's it.
Yeah,
Colin, we are unable to hear you.
yeah. So yeah, definitely I agree with Akriti. Revision is important. So, but what I've realized is that when you are sitting the MD exam, you realize that there's something that you had read in your first year, and you suddenly remember it and you put it down in your this. So definitely it makes sense to read for the joy of reading, expand your horizons. In the comment, Dr. Gaurav pointed out how more than just psychiatry, it's also understanding lived experiences, social and socio cultural context of illnesses and all, which may not always get this. So it's always good to also read about those things, because you realize that helps you get pieces in the puzzle that psychiatry often is. So definitely keep reading with the joy of reading, especially in your first year. Second year, move a little bit more towards the specialties. Third year, last 3 4 months, definitely like after the thesis is done, go ahead and focus more on revising what you have learned and adding and compiling the things that you have learned, because you know that there'll be many of the things that you would have read, but you might not have a chance to touch in the month before your exam.
Okay.
Yeah. And enjoy the experience of learning.
I think
Okay.
I'll just like to add about the clinical part. Many a times, what happens is the last 6 months, a lot of PGs stop seeing patients. They are just in the library. They're just reading. So don't do that mistake. Maximum learning is from what you're seeing. If you are going and seeing delirium case and you are seeing 5 symptoms, that is what you're going to write in the exam first. So keep on seeing patients, taking history even in your last, like even at least weekly, you're taking one patient. And in exams, be confident about your diagnosis. Like if you've heard that yesterday that person was telling this was a diagnosis, so don't go with that flow. Be confident about your diagnosis. Confidence matters in exams and Viva. It is very important. Whatever you know, whatever you feel as a clinician and as a diagnostic. So say keep differentials. Don't stick to one diagnosis. Don't be rigid about it. We are going from categorical to dimensional approach anyway. So yeah, that is something you can do for clinical part. Yeah.
Okay. I mean, I think we have already crossed time. I was just looking through the chat box to see for some questions. I mean, there are a lot of suggestions which are given there. I think I'm this session is being recorded, so I'm assuming this will be available to the students online because they wanted the list of non-academic books. Somebody asked a question with regards to community psychiatry. Any specific books before we end? Is there any books that any of you would like to recommend with regards to community psychiatry?
For me, I went Tips Volume 2 includes a lot of topics for answer writing. Then you can guide, there are a lot of guidelines online. You can download NMHP, NMHS survey, and you can have this National Suicide Prevention, NSPS guidelines are there. Telemedicine guidelines are there. So all these guidelines are available online also. So, and there are very good PPTs also available. A lot of people in the whole of the country have a group of psychiatric residents. They all do their work and they put their PPT. So you can refer to them also. So I have not read any specific book for community psychiatry as such.
Dr. Akriti, specifically to you, Tapish wants to know a little bit on autism. Is there any specific book for that?
Autism, a lot of therapy books are available. Definitely, we can refer to parent management techniques, and there's a book by Kaufman, Autism Breakthrough, mentions that a lot of book written for ABA and the teach therapy has been given recently. So yeah, it's very vast actually.
Okay. I think we have crossed time. So, I mean, I would like to end today's session thanking each and every one of the panelists, from Dr. Sonakshi to Dr. Mohit to Dr. Akriti and Dr. Colin. It was an interesting session. You all took a lot of trouble and effort to get in all the books and add in all the details. Uh, I'd like to thank Dr. Sushil for giving me the opportunity to moderate this session with an equally interesting panelist group. And yeah, I'm hoping the session was helpful to the PGs. I mean, I would have enjoyed this, even if I was in the first year or the second year. Knowing the books you need to read from makes it so much more easier. So yes, thank you once again to you all for taking time out on the Sunday morning. And yeah, thank you to all those who attended the session. We hope to see you all again at the next Scholarly Sunday session. So thank you once again.
Thank you, ma'am.
Yes.
Thank you.